Namaste. Welcome you all for the yoga session. In this session, we are going to do the standing posture Prasarita Padottanasana in conjunction with some rejuvenating movements for the lumbopelvic hip complex. We shall first start with some preliminary postures for the core muscles. Lie on your back, fold both the legs, heel closer to the hips, foot 6 inches apart, foot parallel to one another. Feel your breathing. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Feel also the posterior region at the lower back that also responds to the breathing. Watch your breathing. Chest should be reasonably stable, neutral. Watch the movement of the diaphragm. As you inhale, allow the abdominal cavity to expand throughout, all around, circumferential expansion of the abdominal and the pelvic cavity. As you exhale, it should contract. Towards the end of exhalation, try to contract the abdominal muscles little more than normal. This is a very fundamental breathing which has to be implemented throughout in all the postures. This breathing not only helps the abdominal muscles but also helps the mind to calm. Stretch both arms up. Breathe consciously. Neck at the center, chin towards the chest. Rise your right leg up. Stretch the heel. Pull the kneecap. Toes towards the knee. Pull the kneecap. Tighten the quadriceps, the front of the thigh. Feel the stretch at the back of the thigh. Watch your hip. Watch the gluteal muscles or the muscles of the hip. Watch your back muscles. Press the left foot. For that you got to activate the calf muscle. Also contract the hamstring muscles against the calf muscle and feel the knee capsule. That is the outer covering of the knee on your left leg. Fold right leg down. Left leg up. Pull the kneecap. Stretch the heel. Consciously watch the muscles of the leg, especially the calf muscle, hamstring, then the muscles of the hip and also the lower back. Do not miss out on your breathing. Breathe at ease. Down. Right leg up. When raising the legs, also ensure that the base of the spine does not take off the floor. Pull the kneecap. Stretch the heel. The muscles of the leg, especially the hamstring, they help the back a great deal. Right leg down, chain, left leg. Pull the kneecap, stretch the heel. The hamstring muscles are connected to the hip bone, and on the hip bone sits the spinal column. So they are all involved in a kinetic or kinematic chain. The health of the hamstring. So feel the stretch. Relax the left leg. Right leg up. Fold. Hold the right knee from both hands and pull the knee closer to the chest. And keep the foot, knee and the hip in the same plane. That is, do not move the knee out of the plane. And on both the legs, squeeze the hamstring muscles against the calf muscle and feel the inner corners of the knee. Also feel the outer covering of the knee capsule. Watch your breathing. Release right leg. Left leg up. Fold. Hold the knee. Press the knee closer to the chest. This particular posture does help the gluteal minimus and the gluteal medius muscles. These are the two muscles in the region of the hip that greatly helps in all our walking. Pay attention to the breathing. That is the key. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Release left leg. Right leg up. Fold, hold the knee, press the knee closer to the chest. Stretch the heel, right heel, that is toes towards the knee. Do not neglect the left leg. You should press the left foot. For that you have to activate the calf muscle, then contract the back of the left thigh. Watch also the posterior skin, the thick skin resting on the floor. Release right leg. Chain. Left leg up. Fold. Hold the knee. Press the knee closer to the chest. The posterior thick skin on your lower back, the thoracolumbar fascia as it is called, that also responds to breathing. Just watch that. It also experiences a mild stretch as you inhale and a contraction as you exhale. Get connected with the posture, get connected with the breathing, be present. Release left leg. Right leg up. Fold the knee from left hand, hold the ankle joint, pull it closer to the root of the left thigh. From right hand, push the knee. On both the legs, contract the hamstring muscles, the back of the thigh against the calf muscle to enhance the feeling of the knee capsule. As we inhale, sensitize the base of the spine. Feel the base of the spine, especially the sacroiliac joint. That is the articulation between the iliac bone and the sacrum of the spine. Release the right leg. Change. Left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh. From left hand, push the knee. It's very important to have complete postural awareness. Do not allow the pelvis to rotate. Release the left leg. One more time. Right leg up. Fold from left hand, hold the ankle joint, pull the heel closer to the root of the thigh. From right hand, push the knee. Activate the back of the thigh on both the legs. Breathe consciously. Feel the base of the spine. All these postures are designed to help the core muscles, which would include the region of the abdomen, the lower back, the hip, the pelvis. Because this is the region which takes a lot of loading. And these postures prepare one to safely practice other postures. Release right leg. Change. Left leg. Fold from right hand, hold the ankle joint, pull the heel closer to the root of the thigh. From left hand, push the knee. This posture also obviously helps the knee joint, the hip socket also gets a good soothing movement. The sacroiliac joint experiences a mild but very necessary movement. Good breathing is the foundation for all these postures. Release left leg. Right leg up. Fold from left hand, hold the ankle joint. Pull it from right hand, push the knee across the chest. This is a very good stretch for the gluteal maximus muscle, which is one of the major muscles located in the region of the hip. Again, watch your breathing. As you inhale, the abdominal cavity should expand, as you exhale, it should contract. Release right leg. Left leg up. Fold from right hand, hold the ankle joint. Pull from left hand, push the knee across the chest. Press it closer to the trunk. Now here the abdominal muscles and organs also stand to benefit because of enhanced massaging movement under the pressure of the thigh. Do not neglect the right leg. Press the right foot. Tighten the calf muscle. Tighten the back of the thigh. Release left leg. One more time. Right leg up. Fold from left hand, hold the ankle joint. Pull from right hand, push the knee across the chest. Feel also the lower back. No muscle acts in isolation. They are all connected in a great kinematic linkage. So that is why all these varied movements are essential to keep this whole chain of movements healthy. Release right leg, chain, left leg up, fold, from right hand hold the ankle joint, pull, from left hand push the knee across the chest. You must do these postures with awareness. Mechanical movements does not yield great results. The movement should be done with awareness. You must be present. You must get completely involved. Release left leg. Watch your breathing. Right leg up, fold, hold the knee, press the knee closer to the chest. Stretch the right heel. Now lift the left foot, keeping the heel on the ground, then slowly sliding the heel, straighten the left leg. Pull the kneecap. Push the knee as close to the ground as possible, while you draw the right knee as close to the chest as possible. So right hip is going towards a strong flexion, while the left hip is going to a neutral position. In effect, this is a very good movement for the back muscles. Slowly fold your left leg, taking the heel closer to the hip. Release right leg. Chain. Left leg up. Fold, hold the knee, press the knee closer to the chest. But completely pull the knee. Keep the left heel active, toes toward the knee. Then slowly slide the right foot, keep the heel in contact and gently slide, straightening the right leg. Right heel also have to straighten, toes towards the knee, pull the kneecap, charge the thigh as close to the ground as possible. Feel the region of the tailbone. Breathe well. All these movements are very useful, especially in the beginning. Slowly fold your right leg, release left leg. Right leg up, fold, hold the knee, press the knee towards the chest. It's also important to repeat these postures. Then slowly slide your left leg forward, straightening the left leg. When you do that, ensure that you maintain the line and length of the left leg. That is, you should not deviate the axis of the left leg. Watch your breathing. Feel the hips, feel the thigh, feel the lower back. Slowly fold left leg, taking the heel closer to the hip, then release right leg. Chain. Left leg up, fold, hold the knee, press the knee closer to the chest, stretch the heel, gently slide the right foot, keep the heel in contact with the ground, raise the foot, then stretch right leg. Pull the kneecap. Feel the pelvic cavity also as we inhale and exhale. So these movements prepare the core muscles for further action so that they become very safe to practice. Slowly flex the right leg, then release left leg. Just be attentive. Right leg up, fold, rest the right ankle just below the left knee, rise the left leg from both the hands, clasp the left thigh, pull closer to the chest. Also move the right knee slightly away from the trunk. Feel the region of the hip. You must feel the deeper muscles in the hip. Keep both the heels active. Slowly bring the left foot down. Take the right leg down. Chain. Left leg up, fold. Keep the ankle slightly below the knee. Rise the right leg, clasp the thigh from both hands and pull closer to the trunk. Both the heels active, toes towards the knee, which means the calf muscle gets a good stretch. Do not lose track of the breath. Release right leg, left leg also down. One more time. Right leg up, fold, ankle joint just below the left knee, stretch the heel, rise the left thigh. Now from left hand hold the left thigh, pull from right hand to push the right knee. Now you can feel enhanced stretch deep in your right hip. You are stretching one of the important muscles, the piriformis muscle, the deeper muscle in the hip, which happens to be very close to the sciatic nerve. Release the legs, right leg also down. Chain. Left leg up, fold, ankle just below the knee, rise your right leg with knee flexed. From right hand, pull the right thigh, from left hand, push the left knee. Keep the heels active. So all these postures rejuvenate the muscles in and around the lower back, hip, pelvis. The hip joint also gets a very rejuvenating movement knee and ankle also becomes active. Release the right leg, left leg also down. These set of movements help one to prepare in a safe way for doing other postures. Rise both legs up, hold the knee, press the knee gently towards the chest. Breathe well. Even here, stretch the heel and tighten the hamstrings against the calf muscle. You must make the posture as effective as possible. Also watch your breathing. Watch the posterior region, that is the thick skin resting on the mat, especially the lower back and the lower part of the upper back. That's where a thick skin, the thoracolumbar fascia, is spread. Just watch. And tightening the hamstrings helps the knee capsule a great deal. Stretching the heel helps your ankle joint, the arch of the foot, the intricate muscles, ligaments and joints in the foot also. Do not neglect the muscles of the forearm and upper arms. That also you should actively engage. And of course, you've got to breathe consciously. So when you do all this, your mind cannot oscillate. It will be in the posture. That is when the posture becomes a yoga asana. Release the legs. Feel the breathing. Stretch your left leg forward. Roll onto the right side. Press the left. Stretch your left leg forward. Roll onto the right side. Press the left palm. Slowly get up. So these are some of the basic postures that greatly helps one to relax the most taxed portion of our system. Sit upright on your heel in Vajrasana, keeping a folded blanket below the knee. Watch your breathing. Kneel down. Right leg forward. Right knee bent at 90 degrees. Both hands on the waistline. Inhale, exhale. Flex the right knee completely. Ensure to press the right foot. Stretch the left heel, tighten the left calf muscle. Breathe well. As we inhale, abdominal cavity should expand. As we exhale, it should contract. Elbows closer, open the chest. Feel the lower back. Activate the left calf muscle, stretch the left foot. You may see that you sit as much as possible. Slowly come up, take your right leg back, chain, left leg forward. Inhale, exhale. Pressing the left foot, flex the left knee completely. This is good for the hip flexors. Left foot in dorsiflexion, right foot in plantar flexion, left knee is completely in flexion, right knee is nearly neutral, left hip in flexion, right hip in extension. Watch all the major joints and muscles of the lower extremities. Watch your lower back. This is a good posture for the lower back and also the hips and the pelvis. Slowly come up. Take your left leg back. Join the knee. Sit on your heel. Sit upright. Kneel down, both hands on the waistline. Take your right leg forward, right knee bent at 90 degrees. Left leg straight, right leg also straight. Turn the trunk, bend forward. Keep both hands on the floor. Keep the fingertips, both foot slightly inward. Stretch the spine. Keep on pulling the kneecap. Press the palm. Slowly stretch the spine, slowly bend, taking the head towards the blanket. Rest the head on the blanket. Be strong on both the legs. Press the outer edge of both the foot. Flex the elbows, stretch the trunk. As we inhale, abdominal cavity should expand. As we exhale, it should contract. Padottanasana. Learn to stretch the trunk downward and take the head closer to the ground. Both legs straight. Feel the gluteal region. Feel the hamstrings. Feel the base of the trunk. Press the palms, slowly rise the trunk up. Take your right leg back, sit on your heel, sit upright. Prasarita Padottanasana helps all the trunk muscles, helps the lumbopelvic hip complex also. Now take both hands forward, rest the fingertips. Chatushpadasana, then take your right leg forward, press the right heel, keep the right knee slightly flexed, heel should go beyond the fingertips, stretch the heel, press the heel and pull the heel towards you without allowing the heel to slide. Chest and navel up, feel the back of the thigh, the hamstring muscles. Then gently extend the right knee, pull the kneecap, push the root of the right thigh down and stretch the trunk and navel up. Feel the intense stretch on the hamstring muscles. Feel the gluteal muscles. Rejuvenating this is very important in any forward bending of the trunk. Trunk forward bends will be safer and better when the hamstrings and gluteals are properly engaged. So this posture helps the hamstrings. Slowly take your right leg back. Chain. Left leg forward. Flex the left knee a bit, toes towards the knee, press the heel down, pull the heel towards you without allowing it to slide. Feel the back of the left thigh, chest and navel up. Then slowly straighten the left leg, pull the kneecap. Feel the back of the thigh, the hamstring muscles. Do not hold the breath. As you inhale, abdominal cavity should expand. As you exhale, it should contract. Slowly take your left leg back. Sit on your heel. Sit upright. Kneel down. Right leg forward. Right knee bent at 90 degrees. Straighten both the legs. 4 to 4.5 foot apart. Keep the fingertips on the floor. Turn the trunk. Stretch the spine. Look up. Press the outer edge of both the foot. Inhale, exhale. Keep both the palm on the floor, and as you exhale, flex the elbows. Take the head towards the floor. And from both hands, hold the ankle joints. Stretch the trunk. Be strong on both the legs. Keep on pulling the kneecap. Now release the palm, press the palms, slowly raise the trunk up. Flex the knees, come back to Vajrasana, sit on your heel. Sit upright. Bending of the trunk is one of the most common movement in our day-to-day life. Now stand flexing the knee. Flex the knee completely in Kakasana. Hold the big toes from both hands. Extend the knee a bit, and then stretching the spine, slowly straighten the knees. Stretch the trunk diagonally downward, arms straight, look up, so that you can induce a better stretch for the muscles of the trunk. And this forward bend of the trunk should be accomplished mostly by the flexion of the hip. For that, the gluteals and hamstrings must be activated. So you have to engage the back of the thigh. Do not hold the breath. Breathe well. Feel the pelvis, feel the lumbar region. Gently flex the knee. Sit on your heel, sit upright. bending forward properly, that is, training the muscles for proper forward bending helps in preventing lot of injuries related to the back. Kneel down, take your right leg forward, knee bent at 90 degrees. Keep both hands on the mat, straighten the legs, turn the foot inward, press the outer edge of both the foot, press the palm, stretch the spine, inhale, exhale, bend down, taking the head, rest the head on the blanket, stretch the spine. The distance between the foot should be about 4 feet. Don't make it too wide in an attempt to take the head towards the floor. Pull the kneecap. Feel the trunk. So this is also good for the abdominal muscles, abdominal organs, the diaphragm, the upper extremities also see a reversal of the force field of gravity. Press the palms slowly, rise the trunk, flex the knees, come back to Vajrasana, sit on your heels, sit upright. So these postures tune the trunk muscles, the hip and the hamstrings so that forward bendings can be made very safe. Foot 6 inches apart, flex the knee, sit in Kakasana, stretch the trunk, hold the ankle joint, straighten the knee a bit, ensure that the abdominal region flush against the top of the thigh, stretch the spine, keep the knee flexed and stretch the spine. Then slowly and gently straighten the knees. Grip the ankle joint, stretch the spine completely down. Keep on pulling the kneecap. Foot parallel. Ensure that the weight is well balanced on the foot. Even pressure on the heel and sole. Keep on stretching the trunk. Keep on activating the gluteal muscles and the back of the thigh. Keep the neck relaxed. Uttanasana. Slowly flex the knee. Sit in Vajrasana. Stand up. Stand in Tadasana. Join the heel, join the big toe. Both hand on the waistline, thumb towards the spine, chest and navel up. Jump 4 to 4.5 foot apart. Turn the foot slightly inward. Press the outer edge of both the foot. Slowly and gently bend the trunk down. Keep the palm on the floor, stretch the trunk, stretch the spine, and rest the head on the mat. And now this time ensure that the head is almost in line with the foot. You can flex the elbows. As you inhale, abdominal cavity should expand. As you exhale, it should contract. Now stretch both arms sideways and hold the foot. Stretch the trunk further down. Prasarita Padottanasana. So there is also a reversal of blood flow towards the heart and the lungs. Be strong on both the legs. So this rejuvenates the leg muscles, the lumbopelvic hip complex, and also provides a good downward movement for the abdominal and pelvic organs. Helps the diaphragm. Now release the arms, press the palm. Slowly rise the trunk up. Rise the trunk up. Jump Tadasana. Fold the blanket so that you can have a better height to sit upright in the cross-legged posture. Swastikasana, hips on the blanket, foot on the mat, sit upright. Chest and navel up. Inner exhale, turn to your right side. Left hand to right knee, right hand fingertips on the floor. Inner exhale, turn. Chest and navel up. Breathe well. Twisting motions are good to do with these sorts of forward bends, especially in the beginning stages, because these twists help to reduce or remove the stiffness in the lower back muscles. Slowly come up. And chain. Right hand on left knee, left hand fingertips on the floor. Inner exhale, turn. Turn the neck also in the direction of the twist. Watch your breathing. As you inhale, the abdominal cavity should expand, and as you exhale, it should contract. The twist also helps to rejuvenate the abdominal organs. Slowly come up. Sit upright. Take out the blanket, stand up in Padottanasana. Join the heel, join the big toe, pull both the kneecaps, roll the thighs in. Both hands on the waistline. Inhale, exhale, jump 4 to 4.5 foot apart. Turn both the foot slightly inward, press the outer edge of both the foot, both legs straight. Inhale, exhale, bend forward. Keep both the palm in line with the foot. Inhale, exhale, bend, taking the head also in line with the foot. From both hands, hold the foot, stretch the trunk further, resting the head in line with the foot. Be strong on both the legs. Pull the kneecaps. Feel the hips. Feel the lower back. Feel the pelvis and abdomen. The muscles of the pelvis and trunk are also benefited. The diaphragm, the lungs and heart also are benefited in this. Prasarita Padottanasana. Use your breath to mobilize the diaphragm properly. And contract the abdominal region little more than normal as you exhale. Release the palm, press the palm, straighten the arms, raise the trunk. Now slowly come up, both hands on the waistline, jump Tadasana. Sit on the blanket in Virasana, foot to the side, hips on the folded blanket, foot by the side of the folded blanket. Clasp the fingers. Inhale, exhale, stretch both arms up, open the face of the palm. Stretch the palm up and move them slightly back so that you can get a better stretch all the way from armpit, the upper arm, elbow, forearm, wrist. Tighten the muscles of the upper arm. Virasana, the soldier's posture helps in removing the fatigue in the legs. It helps the leg muscles to relax. Chest and navel up. Stretch the trunk from the arms. Flex the arms. Slowly get up from Virasana. Stand in Tadasana. Join the heel, join the big toe. Pull both the kneecaps. Jump 4 to 4.5 foot apart. Stretch both arms sideways. Press the outer edge of both the foot. Pull the kneecap. Slowly bend forward. Hold the foot from both hands. Stretch the trunk further and rest the head in line with the foot. Stretch the spine completely. Be strong on both the legs. Engage the gluteal muscles and the hamstring muscles properly. Breathe well. As we inhale, abdominal cavity should expand. As we exhale, it should contract. Prasarita Padottanasana. Very good for the leg muscles. Good for the hips, the lumbar region and the pelvis. Complete trunk gets benefited because of reversal of blood flow. And also the forward bending. Feel the posture, be present, get connected with your breathing. Now slowly come up, stretching both arms sideways. Inhale, exhale, jump, Tadasana. Sit upright in Swastikasana. The Prasarita Padottanasana helps to rejuvenate the complete body, and in this, because of the orientation of the trunk, there is a better reversal of the force field, especially for the abdominal organs, and this would benefit the diaphragm, heart and the lungs also. Namaste.